UAB Training for CI Therapy online. Hi, my name is Mary Bowman. I'm an assistant professor at the UAB Departments of Occupational Therapy and Physical Therapy. I'm the clinical director of the UAB Neuroplasticity Rehabilitation Program that offers constraint-induced movement therapy at UAB. And I'm an instructor for the UAB Training for CI Therapy.
Hi, my name is David Morris. I'm professor and chair in the UAB Department of Physical Therapy. I'm also training director for the UAB Constraint-Induced Therapy Research Group.
We are here to tell you about an online training program that we've developed for therapists interested in using constraint-induced movement therapy to improve upper extremity use after stroke.
Let's start by describing constraint-induced movement therapy, or CIMT. This rehabilitation approach was developed over 3 decades ago by Dr. Edward Taub, professor emeritus here at the University of Alabama at Birmingham. The approach was derived from animal studies conducted by Dr. Taub as far back as the 1960s. Mary and I had the good fortune to be mentored by Dr. Taub, and both of us were part of his research team here at UAB for many years.
The positive effects of CIMT can be explained by 2 different but related theoretical constructs: overcoming learned non-use and promoting use-dependent cortical reorganization. We will describe these concepts in other videos to come.
The protocol that we address in our online training was developed by Dr. Taub and his team here at UAB and consists of multiple treatment strategies that fall into 3 broad categories of activities. The first category includes structured movement training that are done in a clinic or research laboratory under the supervision of a therapist. In our signature upper extremity protocol, this training is delivered for 3 hours a day, every weekday over a 2-week period. However, we are now exploring new delivery schedules that are more typical of most rehabilitation clinics. The structured movement training techniques used in our laboratory and clinic are called shaping and task practice.
Another category includes strategies that constrains or encourages use of the more affected upper extremity. One strategy commonly used in our protocol is the use of a mitt restraint on the less affected upper extremity that is worn through most of the participants' waking hours during the 2-week intervention period. The mitt discourages the use of the less affected upper extremity and encourages functional use of the more affected upper extremity. Other strategies can be used to encourage the use of the more affected upper extremity, including prompts and reminders, and even activity monitors that are worn on the more affected upper extremity.
Finally, the third category of strategies includes a set of behavior management strategies that promote functional use of the more affected upper extremity while the participant is away from the clinic or lab setting and is engaged in activities of daily living at home and in the community. We call this category the transfer package, as it transfers improvements made in the clinic or lab into the home and community setting. Of note, we believe these strategies are the most powerful component of the protocol, yet they are the most often overlooked part of the protocol. As such, we emphasize these strategies in our training program.
So let's tell you more about the online training program. It consists of 15 online training modules that are listed on this slide. They include Introduction to the Training Program, Overview of CI Therapy, Theoretical Basis 1, Learned Non-Use, Theoretical Basis 2, Neuroplasticity, Participant Screening, Motor Activity Log, Research Findings 1, Early Studies, Shaping, Task Practice, Transfer Package, Research Findings 2, strategies to assist restraint use, therapeutic alliance, patient education, and special cases, adaptive equipment and activity adaptation, as well as splints and orthotics, clinical administration of CI therapy, and a summary.
To facilitate learning, these multiple learning opportunities include check-in activities that help to assure that participants understand key concepts, post-module quizzes that further check the participants' understanding, additional resources that include articles, demonstration videos, and instructional manuals, a discussion board where participants can make comments or pose questions about the material presented. This board is monitored by Mary and myself, and we respond on a frequent basis. Live question and answer sessions that are held on Zoom at least twice during the 3-month training period. And we record these sessions and post them for those who cannot attend.
Training participants sign up and take the training as a cohort that spans a 3-month period. Participants can sign up and start the program at any time during this 3-month period. They engage in the online modules at their own pace, with multiple opportunities to ask questions and to learn the concepts in depth. You can learn more about our online training program and sign up by visiting our training website at go.uab.edu/online-CI-training.
We have tried to keep costs for participants low, and tuition for the upper extremity CIMT training is $375 for occupational therapists, physical therapists, occupational therapy assistants, and physical therapist assistants, and $225 for occupational therapy students and physical therapy students. Continuing education contact hours are awarded to the UAB School of Health Professions.
We are also working on additional training modules that address the pediatric and tween upper extremity CI therapy protocol, the teenager and adult lower extremity CI therapy protocol, and the adult and teenager grade 5 upper extremity CI therapy protocol for participants with severe upper extremity impairment. Stay tuned, we expect them to be available in 2025. We're happy to answer any questions you may have about the UAB training for CI therapy online. You may go to the website for more information, or you may email mbowman@uab.edu. We look forward to hearing from you.